So hello everyone, I think it's time to kick off the webinar today, which is about the introduction to systems approaches in public health. Where are we up to and how are they being used? It's part of the Systems Science Special Interest Group of the International Society for Behavioral Nutrition and Physical Activity. Very nice that you're all here. I will quickly talk you through the agenda of today. So James will start in a bit about the welcome and the launch of the SIG. Then Sophie will provide a short introduction to the session. Then we're looking forward to a very nice presentation of Leandro about laying the picture of systems science in the context of public health. Then we have a very nice panel discussion where Leandro will be joined by Fiona and Hayley. Very nice that you're all here today. And we will wrap off with a group activity about what would members like to see in the webinar. We're really curious to hear about what other things you're looking forward to. And then we will close and you will hear a bit more about the next date. It would be very nice if you have any questions or things like this, please use the chat function so we can make it a bit a more interactive session. That's always nice next to just a webinar. So feel free to use the Q&A session. I think that's it for now. Off to you, James.
Straight to the point. Hi, everybody. Really lovely to see so many of you on this Monday afternoon. As Maud said, thank you very much for joining us. I hope you find this as useful as it can be, and hopefully an opportunity to be able to network with others who are interested in the use of systems science within this space. I just wanted to give a little bit of background to where the idea for the Systems Science Special Interest Group came from. And then Alex is going to kind of talk through what the aims and objectives of the SIG are. So I'm not going to labour any of these points really, because we want to be able to get into this and hear Leandro speak. But as many of you will be aware, there have been really rapidly rising calls for the use of system science in lots of these kind of public health challenges and spaces that we're working within. So possibly no more so than in the world of overweight and obesity prevention and management. We've seen lots of calls to action there with regards to the use of systems science and also systems approaches. Two, in line with the kind of notion of ISBNPA, there's been an awful lot of calls with regards to the use of these approaches as well for physical activity. And then more broadly in the public health sphere. And there's been within the UK and also internationally calls for the use of system science in policy making and thinking. But it's not just within, I guess, these documents that we've seen these calls to action, but also in the last 5 years or so within, oh, sorry, Maud, can we just go back a slide if that's all right? In the last kind of 5 years or so within ISBNPA, we've seen like a real rapid interest kind of accumulating in systems science. So that kind of image on the right-hand side was from the Congress in Uppsala a few years ago. And there were multiple systems science kind of sessions or workshops delivered, symposium delivered, and most of those were standing room only. So it was on the back of like all of these things that we thought, well, maybe there's room within this particular society for a specific focus on how system science might be able to play its part and help us advance, I guess, our thinking and our doing in these particular spaces. So just moving on to the next one, Maud, if that's all right. Again, many of you might have seen this document before, but this was something that was put out by the Academy of Medical Sciences and the Canadian Academy of Medical Sciences. And it was a really nice report just summarising where we're up to now with regards to the use of systems-based approaches in public health. Now, I'm not going to speak too much at all about these because this is what Leandro is going to delve into in much more depth. But it gave us this really nice summary of, I suppose, where we are now and then what the future recommendations were. And in and amongst all of this was, particularly in the future recommendations, the need for us to start building these local, national, and international communities of practice around the use of systems approaches. So with all of this kind of combined and taking into account some of those limitations on the left-hand side, this is why we kind of thought there is this real need for and an opportunity for the Systems Science Special Interest Group within ISBNPA. So On the back of that, quite a few of us got together. If any of you have engaged too with the Systems Evaluation Network before, this is a little bit broader than what the Systems Evaluation Network focuses in on. This isn't just about evaluation, this is about how can system science really help our thinking in the design, the implementation, and also the evaluation of public health approaches. So we're going a bit broader than what the focus is of the Systems Evaluation Network. And so what I'd like to do now is just hand over to Alex, who's just going to walk through what the aims of the Systems Science SIG are.
Thanks, James. So as James has highlighted, the systems orientated research has gained increased interest within ISBNPA in particular, which signifies the level of interest in such topics within the conferences and sort of the ISBNPA remit more generally. So we felt the timing was right to have a special interest group which focused specifically on the application of system science in dietary, physical activity and broader population health-related fields. So the broad aims of the System Science SIG are to showcase the innovative system science work within the ISBNPA remit, to raise the profile of system science and its utility within the ISBNPA remit, identify the strengths and weaknesses of current system science application and identify opportunities for its advancement, and to create a dedicated network of ISBNPA members who seek to advance the use of system science. We are to the next slide, please, Maud. Thank you. In terms of working towards these broader aims for the SIG and based on sort of previous learnings from other networks, we're planning to adopt an approach within the System Science SIG whereby the focus of the SIG is largely guided by the needs and interests of SIG members. So the SIG on the whole aims to provide a safe space for people to discuss, debate and develop contemporary ideas, and the leadership is distributed across a dedicated organising committee who I'll introduce in a second. As such, the short-term objectives of our SIG are to develop a membership base for the SIG, which we're well underway with, which is an exciting good start. We are looking to plan activities for the SIG at the annual conference, such as an annual SIG meeting, and provide information of this in advance to the conference. We're also looking to organise activities outside of the official conference programme, which we'll communicate through the newsletter and through social media. We are looking to organise at least one webinar that will take place outside of the annual meeting per year. In terms of our ways of working, we will maintain regular contact with SIG members through a newsletter email and explore opportunities to promote collaboration between different SIG members. We'll annually report on SIG activities, and then finally, we'll identify opportunities for alignment between the System Science SIG and other ISBNPA SIGs to promote collaboration between those. Next, thank you. In terms of our leadership team, so James and I co-chair the SIG, but we've got a fantastic group who work around us to support us with the leadership of the special interest group. So we're really fortunate that the individuals named on here are supporting us with the direction of the SIG. We do have some specific roles the individuals engage with. So in particular, we have Elena and Laura who focus on developing the newsletter, Sophie and Maud who work on the webinars, and then Jen who works on social media. I'm going to pass you over now to Sophie, who's going to introduce the webinar today.
Thanks, Alex. Hi, everyone. So yeah, the title of today's webinar is an introduction to systems approaches in public health. Where are we up to and how are they being used? We're very excited for our first ever webinar, and we have with us some fantastic presenter and 2 panelists as well. So the first part, I guess, of the webinar is a presentation by Dr. Leandro Garcia, followed by a panel discussion with Professor Fiona Bull and Hayley Lever. And then we're going to finish up with a group activity with just some breakout rooms in terms of trying to gauge what you as members would like to see from webinars going forward. So I'm just going to get straight into it and introduce our first presenter, which is Dr. Leandro Garcia. So Dr. Leandro Garcia is a senior lecturer in complexity science in public health at Queen's University Belfast Centre for Public Health. He works on the development and application of systems thinking for complex system science methods to investigate and address public and planetary health challenges. He co-leads the Centre for Public Health's Complexity, Public Health and Planetary Health Cluster, and is a member of the WHO Collaborating Centre for Research and Training on Complex Systems and Network Science for Non-Communicable Disease Prevention and Control. So, Leandro, over to you.
Thank you, Sophie. Thank you very much, Alex, James, Maud, for organizing this first webinar of our SIG. And thank you, everyone, for joining us for this first webinar. I will just share my screen. We can start. Second. Can you see my screen? Yes. Great. Okay, so thank you again for joining the conversation in this webinar. So I was tasked with the daunting task, I guess, of speaking about where we're up to with systems approaches in public health and where we go from here. So when I try to think first and collect more information about where we're up to in this area, the first thing that came to my mind is that we cannot answer this question before first answering where we want to go with systems approaches in public health. Because of course, depending where we want to go, where we are now is going to look very differently. So to be able to have this conversation, I guess, with everyone, what I would like as a first activity for all of us here in this webinar is for us to have a quick think on why did you use or would use system science in our public health work. So if you could take the chat and perhaps use the next 2 or 3 minutes just to share your thoughts, your ways, or the reasons actually why you are using system science, or what you would use system science in your work, that would be great. And I will share my two in the next slide. So just open the chat here for me as well.
Hello, it seems that the chat is deactivated, so I'm trying to figure that out to everyone.
Do you want to, so is the Q&A open?
Q&A is open, yes.
Yeah, so we can use the Q&A then.
I'll try to unblock the chat, sorry about that.
Just gives more people time to have a think about it, Leandro.
Yeah, I will. So I have some already, so let's see.
But just to let you know that the chat should work now. Sorry about this.
Okay, no problem. So to increase understanding, to apply to public health issues, especially economic evaluation. So current methodological approaches are insufficient to address complexity behind public mental health issues. We see some things in the chat now. Amplify impact and ensure sustainability. To build cool diagrams, yes. To make sustainable population scale changes on complex challenges, better address complex real-world problems, to answer research questions that cannot be fully understood using other approaches. So we can see here that what drew us to system science or a complex science-oriented framework is our feeling that the current or other conventional approaches or frameworks are not capable of answering the questions we are trying to answer, or enact the changes in the world that we would like to see happening. So there is this discontent, I guess, in general, with other approaches that have been conventionally and traditionally used in public health to address some of the problems we are facing. Not that they haven't been useful or successful in the past, but for some of the problems we're interested in, they didn't provide either the changes in understanding and explanation that we wanted, or the actual changes in the real world we wanted. And my two reasons for why I started to work on systems in 2012 are more or less the same. So other frameworks for me were not sufficient to help me first understand and explain complex public health issues and achieve the desired changes. And when we start to think in the application of systems thinking in public health and start to read more about it, it's very clear, of course, that systems thinking in public health is not something really new. So the root of it can be traced to the early 20th century, with the development of systems-based frameworks for understanding disease transmissions within populations, the recognition of the interplay between social conditions and health outcomes, and the advocacy for multi-sectoral approaches to address health inequalities, for instance. They might not have been framed as systems approaches as we know today, but they've been used in public health for a while. However, it's only more recently that systems approaches have been more widely used and recognized in public health research and practice. And this shift gained momentum basically because of three main changes. The first one is that systems science, of course, as a field, got more mature, more developed, particularly from the 1950s, and that gave us more tools, cognitive tools, conceptual tools, but also other methodological, instrumental tools to try to address and understand systems. There was a technological development, especially in the middle of the last century, that made it easier to implement some of the system science methods, which has beneficial effects for us, but also in some ways framed the way we approach systems, perhaps in a more hard engineered kind of system, which has also some disadvantages in the way we apply these methods in public health, or systems approach in general to public health. Again, other approaches conventionally used in public health were more widely perceived as insufficient to alone investigate and tackle complex public health challenges, such as chronic diseases and health inequalities. But when we start to see how systems approaches have been used recently in public health, what we see is that, for instance, based on this review conducted by Carey and published in 2015, is that from 117 papers in this area, most of them were either reviews or call for actions, suggesting that we should embrace systems approaches in public health. And another large fraction of these papers are mostly about modeling systems, either by using systems mapping approaches or more simulation modeling approaches. And a very limited number of these papers try to either use analytical lens more widely to try to understand the situation we're trying to tackle from a systems perspective, or even to apply systems methods or systems informed methods to help us design and evaluate public health practices. This paper is from 2015, but there is a more recent paper specifically about physical activity and public health, but also that paints more or less the same picture. So this paper from Tracy and colleagues investigate 155 papers in public health and physical activity, and found more or less the same trends, right? So a lot of the papers that are published in this area are about theorizing about the applications of systems approaches in public health. There is some, again, big group around modeling, basically prediction in this case, many times simulation modeling, and a very small fraction of what has been produced so far in systems is around intervention development, process evaluation, impact evaluation, and other ways of using systems approach. So there is much more of a focus on the methods that can be applied that have some elements of systems science, more than using systems approaches as an intervention, as a way of framing the situation that you're trying to intervene or trying to make better. So if we do recognize the potential contributions from system science approaches for public health, why we're not able to fully embrace these approaches yet in public health? Or another way of putting these questions is how much of system science approaches are we willing to incorporate into our public health research and practice? And perhaps as important as this first question is, for what purpose? So my personal view of why system approaches haven't been fully incorporated in public health yet is because much of the public health research and practice today is dominated by key principles like the hierarchy of evidence, the study design type, so what counts as good evidence for action, very focused on measuring and predicting outcomes, on causal mechanistic pathways, controlling for confounders, intervention effectiveness, etc., which is a kind of framework that generates the need for certain types of approaches and methods that then generate outputs and results and outcomes in general that lead practice. And because these changes in practice are conducted by these types of frameworks, these practices and the application reinforce the use of these frameworks and then generating this cycle. At some point, as we are experiencing now, we start to perceive that these frameworks perhaps are not being sufficient to deal with the complexity and the problems we're facing in reality and change practice. But still, a lot of the mainstream practice is defined by the frameworks we've been using historically for many, many years in public health. And these frameworks frame the applications, the results we get, the applications reinforce the framework, and we continue in this cycle. So how much of the system science approaches we want to see applied in the public health field, research and practice? So I pose here 3 questions. So do we want to use system science approaches within the frameworks currently established in public health? So as one more tool that help us, or perhaps tweak our frameworks and approaches on how we do public health nowadays. We want system science to be on the same footing of all other frameworks that are dominating public health practice and research nowadays, or we want to go even further and say, well, system science approaches is an overarching framework for how we do public health, and then the other frameworks and the other ways of doing that are within this wider, perhaps overarching framework that is systems oriented. So without answering these 3 questions and trying to understand how far we want to go with systems approaches in public health, it's very hard to actually say where we're up to. So if our objective or our intention is to use system science to expand the current framework, perhaps we're much closer to get that than we imagine. If we're much closer in terms of ambition in seeing system science approaches being on either equal footing or being an overarching way of framing public health, there is a lot of work still to be done. And here's some examples of what have been seen currently in public health of how systems approaches are used. So there's a very instrumental way of using systems approaches, right? So this is an example that is very much more aligned with the use of systems within the current framework. So this is a paper published recently, or 2017, where we compared, the authors compared an agent-based model approach to a parametric G formula for causal inference, which is possible to do, but it goes perhaps against the reasons why we would use an agent-based model. So here's the beginning of the abstract. So decision-making requires choosing from treatments on the basis of correctly estimated outcome distributions under each treatment. In the absence of randomized trials, two possible approaches are the parametric G formula and agent-based models. So I would argue that agent-based models is not something to be used in the absence of randomized trials. It doesn't have that purpose. It doesn't serve that purpose, especially if we're coming from a systems informed approach on how to address, for instance, obesity or physical activity or poor diet in populations. So the way we use or can use the different approaches in or systems-oriented approaches can be much more in terms of, again, being very rooted in the current framework, or could be in a different direction. And my perception is that overall, what we want as a field is that systems thinking and systems approaches are much more on the equal footing stage with other frameworks, or perhaps even, being much more ambitious than that, and being this overarching framework that help us in practice and research. But that being said, I guess another reflection I would like to bring to us is how much of the system stuff that we do continues to operate within the logic of the established frameworks for public health. And that's not a problem in itself. You are okay with that. If we want to continue to operate in the same framework, that's completely fine. But if we want to go beyond that, then perhaps there is an action of reflection that needs to be done. So for instance, how many times have we been focused on the output, for instance, the model or the systems map, instead of the development process where we brought together people to co-design and understand from a different perspective what is the situation is on the system that is underlying that situation, and how we can work together towards a different situation in the future. How many times we use these models for causal explanations instead of structural generative explanations of the reasons why we see some of the public health issues we're trying to face. How many times we use these systems methods and still focus a lot on the variables and elements, let's say, of a systems map, instead of the processes, activities, and human relations that underlie the systems and the situations we're trying to intervene. How many times we develop models for prediction instead of understanding how systems operate. How many times we gave priority to certain types of data and evidence in detriment of others. So for instance, how many times we gave priority to information we got from systematic review of the literature instead of what is coming from the stakeholders with the lived experience of the problem we're trying to sort together. How many times we ask the same conventional questions or objectives that are not always systems laden, and still use some of these systems methods to try to resolve them or have better answers. And again, I'm not against the use of systems methods within this framework if we are okay with that. And there may be reasons where or when, or situations when using these systems-oriented methods within the current frameworks could be what we desire. But if it's not only that, how much we're actually going beyond doing or operating within the current framework. So here's an example of what we can perhaps think could look a trajectory or a future where we go beyond using systems approaches within the current framework where we do public health. So if we are willing to go beyond in the use of systems approach, we need to accept that some level of disruption with current practices might need to occur. I'm not suggesting that we phase out the current frameworks as they continue to be useful, but depending on how much we want to incorporate system science approaches in public health, we will need to revisit at least some of them. So for instance, public health actions or interventions usually tend to focus too much on control or how to public organizations or policymakers control the intervention. And perhaps if we want to have a less or perhaps a more systems-oriented approach on how we deploy and evaluate and implement interventions, there are situations where we might need to perhaps let the control of these interventions go, embrace uncertainty, embrace adaptation, embrace coordination, embrace other ways of working that is not usually the way we operate nowadays for trying to implement public health policies. So just to finalize my presentation, so what we can do as an area, as individuals, if we want to embrace systems science more fully in your practice. So the first one is capacity building on broad range of systems lineages, methods, and tools. I'm not suggesting that every one of us will be a researcher that is well-rounded up on all these things, but as an area, we should try to be more inclusive of other ways of thinking about systems and doing systems approaches, more embracing of different methods, different tools that help us to implement more fully, embrace more fully a systems approach. There is training that is available, of course, for many of these lineages, methods, and tools. But it's also important to have the establishment of these networks as the SIG and the Systems Evaluation Network. There are other people capable of mentoring us in different methods, not only people within public health, but outside the public health area. So this sense of community building. In your organizations, being academic organizations or practice organizations, we should try to facilitate change, and that means encouraging and enabling experimentation, trust, dialogue, and participation. So it involves a certain risk-taking, and many of organizations today are risk-averse. So there is this, again, willingness to accept uncertainty and accept experimentation as we move towards a more systems approach oriented public health. And lastly, perhaps deploy systems approach in a clear, reflexive, and iterative ways. So we need to expect or need to be ready perhaps to be more coherent between what we expect as outputs of our practices and the frameworks and methods and practice that we implement to expect these outputs. So it's going to be very difficult to obtain a systems-wide approach or systems-wide change, if the way we're using the systems approach in a given implementation or intervention is a very technical, in a very instrumental way. For instance, just helping us building a model or trying to predict something, and then expecting with that systems changes will happen in the future or help us to get systems changes implemented in the future. So if we want to see system-wide changes, the way we embrace systems need to go beyond perhaps the the way of being implemented so far within the current frameworks convention used in public health. So I want to finish my presentation with three quotes here that I found very useful preparing this presentation. So the first one is from Donna Haraway. So facts are theory-laden, theories are value-laden, and values are history-laden. So what we consider of value as, for instance, evidence, good evidence, is of course always dependent on the theory and framework we're using. These theories are value-laden and values are history-laden. So the place where public health research and practice is nowadays is, of course, a product of its trajectory. The way that problems are represented influences how problems are solved. So if you want to be capable of implementing systems-wide changes, we need to approach problems from the very beginning using this systems lens. And to be able to think outside the box, we first need to find the box. So we need to be very reflexive on the practice we take, and be sure that, or perhaps be comfortable with the fact that where we are situated is driving the way we are using systems approaches. And if we want to go beyond the current uses, perhaps, of systems approaches, we might need to let some of the boxes behind us. So that's all I had for today. I left also my contact in case anyone would like to chat more or have any criticism or any other thoughts on my views. They're always very welcome. Thank you very much.
Thank you very much, Leandro. Really inspiring presentation. Following Leandro's presentation, we will hold a Q&A panel discussion. So Hayley Lever and Fiona Bull will come in as well. So I would like to introduce them first. So Hayley Lever, welcome. Hayley Lever is the CEO, Executive Officer at Greater Manchester Moving, which leads, supports and connects the movement alongside thousands of organizations across the city region. In the last 10 to 15 years, Hayley learned during a journey that when evidence, evaluation and theory are translated to practice and policy, that then the real change happens. And that's why combining research, policy and practice within systems approaches matter to Hayley. And she believes that this translation is circular and important. Thank you for being here today, Hayley. I would also like to introduce Professor Fiona Bull. Welcome. She's the head of the Physical Activity Unit in the Department of Health Promotion at the World Health Organization in Geneva, Switzerland. Professor Bull leads a team working on supporting countries to increase the participation in physical activity to active transport, sports, and everyday activities through advancing science, policy, and practice. She also led the development of the WHO Global Health Action Plan on Physical Activity and the recent first Global Status Report on Physical Activity. Welcome, Fiona. It's really nice to have you all here. I would like to ask everyone to use the chat to post questions for the Q&A as well. And to kick off, Fiona and Hayley, what resonates from what you just heard from Leandro's presentation?
Hayley, you go first.
I think she said Fiona first, but anyway, I'll dive in. Because yeah, there are a lot that resonates in there for me. Scribbling lots of notes and taking photos of slides, so I'm thinking I definitely need a trip to Belfast quite soon. I think there were some particular aspects for me. First of all, that question about which a few responded to in the chat around the kind of system science as an overarching framework. And I commented in the chat, so I've had 3 conversations today that have demonstrated the need for that. So I'm a strong advocate for STI, first of all, in that area. I think there's a lot for me in the role that I play within Greater Manchester Moving. I'm really interested in the flow between evidence, evaluation, research, and then how we can develop that in ways that enable, so my team and the people who are policy makers and practitioners across the thousands of organisations working on the agenda of challenging inactivity and inequalities in Greater Manchester, to help them to be as evidence-based in their practice as possible, and to be as informed by the research. And for that, and therefore linked to this is the research that we can use and the evidence evaluation that we can use to guide a systems approach needs to, one, exist, and two, be in a format that what we can use to build confidence and capability in the people who are doing the work across different sectors within the region. And very practically, you know, people are busy, so we do a lot of work in our team to make sure, or to try and improve the ease with which that flow can happen. And so people haven't got time or headspace or capacity to digest complex reports and evaluations. So we do a lot of work to make things tangible, practical, actionable, and help people to use them in systems leadership, personal development, and capability building in ways that suit all different people and their preferences and their own styles and learning styles as well. So I'm fascinated by, I haven't got a sense of who else is in the audience, but you know, the ways in which we can make research and evidence, one, more aligned to this way of working, and then two, actionable and in a way that people can absorb it, think about it and use it in real time, and then get that feedback loop going so that the research that's being done is informed by the questions and the problems and the challenges that are coming up in the work.
Thank you, Hayley. Fiona, do you want to add something to that? What resonates for you?
Yeah, very happy to. First of all, a very good morning, good afternoon to everyone joining, and I'd like to thank ISBNPA for this initiative and congratulate you on taking this forward, and your SIG group, which I was very pleased to hear and learn more about. Thank you to Leandro for the excellent introductory presentation, and of course for everyone joining. I'm particularly looking forward to seeing what questions will come through. Let me start by answering your question, Maud, which is, you know, what resonated. And like Hayley, a lot of it resonated. In particular, your opening slide showing us where the publications are, and the majority of them either being describing it or modelling it, and too little about doing it and learning from practice in the middle. And that's a little bit of my reflections and my frustrations, and I think the frustrations that were evident in the chat box by the comments people made about why they're looking to systems approaches, frustration about the lack of progress. Well, I certainly can agree with you on that, and the WHO report shows it, both whether it's in the numbers and prevalence estimates of physical activity, or indeed in the progress of countries implementing some of the solutions that I think we'd largely agree are part of a bigger solution that's needed. And I'm referring here to the Global Status Report that looks and one way tries to capture what countries are doing. I also thought it was particularly useful to sort of reflect on essentially what we're doing doesn't work. And I thought your slide, Leandro, on the on where we are and our focus on the output and not the development process. I'd really like to come back to that and hear more about what you're thinking there. What should it be then if you think we're focusing on the output? How would it look different and be different if we focused on the development? But certainly looking at prediction, looking at causality, trying to control everything is the antithesis to the real world we live in. And I suppose it made me think about, where did I come to this? And why am I here, for example? Why is WHO here? Well, we're here because the Global Action Plan on Physical Activity 2018 actually opened the door to a systems approach. That's a pretty big door it opened, because it shifted the thinking, it aimed to, let me qualify, shift the thinking that there's a single solution. We're not malaria with bed nets. You know, we haven't got the drug. We've got a complex system to which we're trying to, for me, promote physical activity. For many of you here around the diet, overweight, obesity, and generally health. I'm sure we all share this. And yet we really are still focused in the paradigm of single solutions. And GAPA, which is the short name for the Global Action Plan, opened up and said, look, there are not only is physical inactivity a consequence of multiple factors, there's multiple entry points to the solutions, and they're policy driven, and they'll be undertaken by different actors. And so those of you who are familiar with it, I encourage those who aren't, and if anyone can multitask better than me, they could pop the link in the chat box, which I'll do myself later if not. And it's a lovely, lovely diagram in the most simplest of formats because it's circles. And I'll come back to why it's so simple. But essentially, the door was open to say this will take looking at a systems approach and everyone's contribution to these multiple policy opportunities, which will have multiple outcomes. That's why we want everyone to be involved in. Now, with those reflections, let me focus on a couple of things. I mean, by the by, my introduction goes back to like yours, Leandro, almost a decade or more. We did a project in the UK funded by the Science Funding Agency at the time, and it was called iConnect. And I want to acknowledge some of the thinking of David Ogilvy at Cambridge University and others, Harry Rutter and others, where we were thinking about and had the opportunity to do a project that was essentially an infrastructure, walking and cycling and connecting up missing parts of transport systems, bridges, paths that just stopped nowhere and didn't link. Almost absolutely the parallel of a systems thinking. And then we were challenged with how will we assess the impact of these interventions. A small change in a larger, complex city with its broad intent to get more people walking and cycling by connecting up places they can't get to easily by walking and cycling. And what would be the right outcome to be measuring? And we found ourselves with such a small impact intervention. How will we see the impact on this city system? And that was my first introduction, which of course led me on a journey of looking into this. But right now, I would say WHO can't take this forward because we haven't got the implementation science. We haven't got the practice. We haven't got the examples. So I'd like to finish these first remarks by sort of asking, I agree, capacity building's needed, but to whom? I would hope that on that is policymakers and government officials. They don't know how to use it. Let me challenge us all. Language matters. And the more we go on about calling it complex, the door shuts. They don't want to know it's complex. They want to know it's simple, and they want to know how to do it. And I've got countries I'm working with where I could have done it with them, but I didn't have the tools. I agree entirely. There's fantastic drawings. I agree we can get people around the table really thinking about their contribution. But what next? How do we turn the interest of a government and all their stakeholders and, you know, Hayley, your city colleagues, how do you take it forward in practical ways? Be innovative, I agree. Encourage experimentation, build trust. I agree with those, Leandro. But it's going to be tricky in the climate we're in now to take this forward. So I'm very keen to hear about how the work, this SIG group, this global network, and the interests we have can really grow to help. Ultimately, my ask would be, how can you help WHO communicate this to countries to implement it? Thank you. Look forward to the questions.
Thank you, Fiona. Thank you very much, and Hayley as well. Well, I think you perfectly introduced one of the first questions we got. So Maria asked, policy and policymakers do not always follow the evidence. What advice do you have on optimal ways of involving policymakers in participatory systems modeling?
I'm sorry, Maud, were you asking that back to us or to the group?
Yes, to Leandro, Hayley, Fiona.
Can you start? So I guess one of the things that we need to address first is that there are different types of evidence, right? So evidence is not only what comes from the scientific work we do in universities. So for some beyond that, the experience that people have living in a certain problem or a certain situation or a certain problem, it also counts as evidence. So I guess there is a need for us as researchers and people, not only working on systems specific, but in general, to understand that what we consider as evidence is just a small fraction of all the information available out there. And I'm not saying that every information, every piece of information should have the exactly same weight, but for different people in the room, different pieces of information is going to have different weights. So I think the first thing is to accept that. When you're doing a participatory modeling, and any participatory activity, one key question that we usually don't ask ourselves is who is not sitting on that table. So who is left out, right? So, and the reason I'm saying that is that involving the policymaker on that conversation sometimes doesn't happen until the point where we have the model first. So we're bringing to them something that we believe is the best evidence of something, when in reality, that person or the group of people is also first they help to shape reality, and at the same time, they're going to help shape the situation in the future. So what they have to say and their understanding of the current situation is key in the process of continuing to develop that together. So I guess it is working with them as we would work with any other group of people or sectors or groups in a very open-minded, equal footing way, in the sense that basically leveling the field basically of where we are talking. So my knowledge is not more important than your knowledge, or more important than someone else's knowledge, and understand that we're coming from different perspectives, how we can with that come to an agreement of what we're trying to see. There's one of the things that we usually forget to apply when you're using systems approaches, I include myself in this, is that one key, I guess, skill is the capacity of moving to different levels of the same abstraction, basically, from what to how to why something is happening. But the what for me might be the how for someone else, and the why from a different group. So the capacity of bringing all these understandings, not necessarily on the same level, but be able to see that across the room and incorporate that in the discussion, because it's key. I hope that helps to answer.
Thank you, Leandro. Hayley, I'm also very curious, what advice do you have to involve policymakers? You already briefly talked about make complexity actionable.
Yeah, I think it's interesting to listen to Fiona when you're thinking global, and then I'm thinking city region. I think there's actually a lot that translates in terms of how. I'll talk from my perspective on how we have helped people at all levels within this region to understand what the evidence is saying, and then understand how they play their part in it. And again, I'll always come at this from a kind of practical point of view, is you've got some leaders and policymakers and practitioners who've got really wide remit. And then you have some who, say, take physical activity. Some have remit way beyond physical activity. So then, but the evidence around systems approaches is so transferable that it helps them in lots of things that they're doing as well. So, but you've got to make it relevant. So one, they need to be aware it exists, to understand it in a way that's relevant to what they're doing, and that they can translate it easily into what does this mean for how I need to think and be and play my role. And that, whether it doesn't matter where people are in the kind of hierarchy of the system, or which sector they're in, or which role they play, the same principles apply. And what we find is there's no one way of translating evidence into policy and practice, but there are many, many ways to make it accessible. Fiona was talking about the diagram earlier with the circles, and the more the diagrams, I'm writing a book, right? And I was looking back over my career, the last 10 years, and I was thinking about the key moments of change where my mindset and my practice and approach changed. And it usually tied back to a thing, a visual, a report, a piece of evidence that had really became sticky. You know, it was really easy to understand. It was clear that it was different. It was opening the door to a new way of working. And you could find it online. You could go back to it every time you needed to, you know, and all these things really sound insignificant, but they really matter to the extent to which people who want to be evidence-based in their work can access that evidence in a meeting, pop it in the chat in a call, you know, or share it with a member of their team, or show somebody a short video to help people to grab a hold of it and, you know, pull it into their day-to-day work in a really accessible way. And then the other side of it is giving people spaces like this to work things through and talk about it and discuss. And again, that's different people's different preferences and learning styles. But in our team, for example, I run informal learning sessions with the team on some of the models and the tools and the theories that are at our disposal, which people know exist. They might see them, people might talk about them, but they need to understand them deeply enough to have time and space to talk to colleagues about what does this mean for me and my role and my contribution. And that can be around, just most recently, we did a session last week, I think it was the week before, with our team, which was looking at the National Evaluation and Learning work that's coming out of the place-based work with Sport England that Dr. Cation is leading. And we had a session where we brought people together in our team. It's to be a really safe space so that there's no judgment as to whether you know about this or you don't know about this. It's about come into the room, you know, where have you seen this? What have you heard about this? What might help you to understand it? Share examples with each other about how you're using it in practice, making it practical, and sharing examples of all the ways in which the National Evaluation and Learning outputs and videos and slides and various practical things can be used. And things become really embedded then. You know, the people are using them really practical ways to help them with their work, whether that's looking at system maturity or stakeholder mapping or revealing the value of the work. If people feel like they genuinely help them to do their job better, they will use them. So just some very practical examples there. I hope that's helpful.
Thank you, Hayley. Very helpful indeed. Thank you. Fiona, I'm curious, do you also have some advice? You already mentioned it's not complexity, but make it simple, even though it's complex. You mentioned earlier. Do you have any other advice?
Yeah, well, I certainly agree with the responses from Hayley in her chat and her comments just there. I think it very much is about making it accessible. I really like this idea of the informal learning, because it made me think about sometimes even the way we structure some of our webinars. They already do presume that there's a without intent, but they presume that you must know enough to come here, and then where we start in a conversation. I think it's just a good reminder, Hayley, there that you know, how you create that space to enable people to open this door to start talking about the systems approach. I think so I won't repeat what Hayley said. Only to pick up that I think what would be very powerful, again, going back to my ask, would be that there was examples from cities that are using this, have taken that step and said, we're going to try this, we're going to do something differently, we're learning as we go, but by sharing it. I think one of the most powerful things I see, whether we're looking at the countries working on tobacco control or more recently bringing in sugar sweetened beverage taxes, these are big, bold moves that governments have to make a decision and leaders have to make a decision on to implement. And what they really want is the confidence that someone else has done it, and they want to see it. And you can both reassure those who are really wanting to do it, or indeed encourage those who aren't by showing it can be done. So I think it's not only tell and then show, but also then I think adding on to that, and this might be ambitious, but maybe it's the long-term goal of some collaboration across governments and researchers and all stakeholders, is how can we help others? And I think, again, there are examples where you know, cities who are doing things are sharing it with another city to almost give a helping hand. So I think that would be the most powerful way. And there's a tension, I want to acknowledge that, between academics who want to research, to publish, and that community, and as Leandro introduced, the paradigm to which what's acceptable for publishing and getting those outputs, versus the very practical world which wants to do it. And there's a bit of a tension, which I think is actually arguably where this use of the word complexity comes. It's fantastic in an academic world, and Leandro, of course, your work there is a complexity centre. That would just about, and I can tell you an honest story. You know, my previous boss, no longer my boss at WHO, as soon as I said, and the conversation went in, we're looking at complex systems, he literally switched off. It wasn't a conversation he could, at that stage a few years ago, when I said GAPA's going to have this, it's really a complex system and we've got to really put this into the global action plan. He said, what on earth do you think you're doing? This won't work. So, you know, I don't have the answer. In your chat, you've asked what's the opposite to complex. Hide the complexity. Don't talk about it in those rooms, in those conversations about it being complex. In fact, the opposite, they want to know that there is a way through. It's different and it'll have different challenges, but it can be done. And that goes back to the show me and help me. Back to you, Maud.
Thank you, Fiona. Thanks a lot for your reflections. I also see Robijn, I hope I pronounced your name correctly. That's a really nice reflection in the chat too. He says that giving people, policymakers, the right language and framing and a way of communicating the subject and its importance in a digestible, non-research way, so they can advocate it to colleagues. I think that also resonates with what we already heard. So that's very nice. Thank you. I think we have time for one short question. So there's also another question. It's from Jonathan. He says, excellent talk and reflections. Thank you. Arguably, causality is king in the current public health frameworks and hierarchies of evidence. There is surely an argument that this is correct, particularly for health outcomes of interventions. Is there indeed, maybe, for systems methods to incorporate more of this causal perspective to be fully embraced in public health too? So do we need a kind of causal perspective for systems methods to be embraced in public health too? That's the kind of question he asks. I'm curious, do you have some short reflections on this regarding the time? I'm really curious.
Yeah, thank you, John. That's a very good question. I was hearing a podcast by Ray Ilson this morning, actually, and he's a very famous systems researcher here in the UK. And he was mentioning something that I forgot about his work in the past, where he makes a distinction between systemic and systematic. So in the sense that systematic probably is the way we work nowadays, more conventionally in public health, where it's more linear, more based on steps and the evidence and the hierarchy of evidence, etc. And systemic, perhaps more what we've been discussing today. And his point is that systematic actually is something that is contained within systemic, in the sense that it is a subgroup of systemic approaches in general. So I don't think we need to negate the importance of a causal approach. For some research questions, I think that's the desired approach to be taken. But for things like developing interventions and implementing them and evaluating them in a complex situation, a complex context, or in the real world in general, they are not sufficient. This approach is more systematic approach per se is not sufficient. But that doesn't mean that we need to negate them. So another word he uses, another distinction he makes is between dualism and duality, where dualism is when one thing undermines the other. And one thing he says that the systemic and systematic, there is no dualism. It's the duality or a dual type of relationship where one and the other can coexist and can continue to be used for different purposes. But still, his argument, and I agree with him, is that the systematic is a subgroup or is contained within the systemic. So that also probably tells a little bit more about my inclination towards question or point C of one of my slides. But yeah, that's my point. Thank you. Well,
thank you, Leandro. Fiona or Hayley, do you have a small reply before we close off the Q&A?
I would agree. I think that if I heard the question correctly, and I'm reading the comments as well, look, yes, I do think we have to have causality within the thinking here. And so if there's a way of better not dismissing it, I don't think anyone in this room is dismissing it, but it shouldn't be polarized. I think what we're trying to do, and I'm thinking now of your diagram on the slide, Leandro, of that pathway where there's a little disruption, that we're changing from where we are now, not only in the research paradigm, but actually in the practice of promoting physical activity for many of us, healthy diets, etc. And there will be the old way and the new way. But we're on a journey across from the old way, which is, come up with a probably, hopefully evidence-based solution, or possibly just a good idea that someone told a minister and they'll launch it next week, through to then implementing and doing things differently. To simplify, language matters, and show that pathway. That what governments could do is come up with the 3 things you'll put in a policy or an action plan and say you'll do next year. And they'll probably have about the same effect as they've had in the last 10 years, because you're not changing the entire system. You're not thinking through with these tools that would stand a better chance. But what does that mean in practice? What does it mean not to just do an SSB tax, build a cycleway, increase physical education in a school? These are all valid pieces of a solution, but they're being implemented. And then we expect prevalence estimates to change. For goodness sakes, we've had 25 years. Prevalence estimates will not change from a single solution, which is like a literal drop in the ocean. So I think we have to, and I hope your discussions going forward about what actions next, language, framing. I saw in a comment from Robin, think about the language we can give others to use so that it's accessible in terms of talking about this idea of systems-based approaches. And then show me, and I'll throw out, because I won't be able to stay to hear all of the suggestions right till the end, but I'd really love to see a journal, a special issue on practical examples of system-based approaches in areas of interest to us. Thanks, Maud.
Thank you so much, Fiona. Hayley, do you have a small final remark or reflection?
I think I'm chuckling because I've written an article of this at the weekend, which I haven't been brave enough to publish without a password on it yet. But for this audience, I will share it with the password. But it is on the line of sight, and that drive to find what's the line of sight between the investment and the outcome. And I went back again to the previous Sport England strategy towards an active nation, which described a very simple: invest in this, get that outcome. And I'm exploring the line of sight in a complex system approach. So I will share it in here. When I'm brave enough, I'll take the password off of it. But you do need both. You do need both approaches. But I think that's why I landed on C, which was you need the overarching framework, the overarching approach to be consistent and aligned to a systemic nature of the work that we have. And within that, where you are doing something that is complicated but not complex, you can measure and have a straighter line of sight between the investment and the outcome and the outputs through the activities that you're doing. If you're delivering a project or a program, that's appropriate, but not if you're trying to work on whole systems approach in a place in all of the complexity. So yes, both and is usually the place I end up in these conversations.
Thank you so much, Hayley, and Leandro and Fiona as well. Very nice panel discussion. Thank you very much. Very inspiring. I think we will go to the group activity next. Sophie, do you want to
Yes,
explain it to us?
Thanks, Maud. And yeah, just to second that, thank you very much to Leandro, Fiona, and Hayley. That was so interesting. I almost don't want it to end. I could have stayed for an extra hour. But we are going to move to a group activity now for the last 10 minutes. So we are going to share a link to move towards a more breakout room style session. So if you just there's going to be a link posted in the chat, and if you just follow that link. But within the breakout rooms, we're going to be looking at these 3 questions. So what would you like to see from the ISBNPA Systems Science SIG webinars? What do you think the SIG can help us achieve in 3 to 5 years? And then any further questions or comments is also going to be areas of discussion, and anything else, any insights or anything else. So I think a link should be shared in the chat now to go to the rooms, and then we'll be allocated to breakout rooms from that link as well. So the link's just been posted in the chat for everyone. They just want to switch.
Please just give us 2 minutes to start the meeting, but I'll stop this one. Okay.
Okay.
Thank you so much, everyone.